it is important that Kenyans appreciate that we have 1.4 million Kenyans who are affected and living with HIV in this country. 1.4 million Kenyans. And they have dependents, they have families. Huu mkataba ulikuwa kuhakikisha kwamba there is a steady supply to ensure that these 1.4 million Kenyans who have a right to life, like everybody else, have a steady supply of medication. We have many Kenyans ambao wanaumia kwa diabetes. Diabetes is a very expensive ailment. They have to have a steady supply of medical merchandise to help them overcome the challenge of diabetes. There are many young children who are being born who must be immunized from polio and other dangerous diseases that can affect them in their early growth. Mkataba huo una program ya kuhakikisha kwamba our children have supplies for medicine. Program hiyo is also conscious that there are many Kenyans who suffer from tuberculosis. They must have a steady supply of tuberculosis. Equally, malaria is a thorn in the flesh in our region. Now, malaria in a strain nyingi, it mutates. One day this medicine works, another day it does not work, and you need another type of medicine. So we need a steady supply of medicine. So this was the package that was being signed to help Kenyans so that they can have access to medicine. Because we talk of universal health care, we must have access to medicine. Equally, kwa huo mkataba, we know very well that the government of Kenya, Parliament ilipitisha the Data Protection Act 2017. Kwa mkataba huo, because I cannot sign an agreement without the approval of the Attorney General, who is a lawyer and they have experts, inside there it is very clear that where there's a difference in matters of interpretation, it is the law of Kenya that shall prevail. Not the law of the United States. The law of Kenya is the one that shall prevail, because the data we are talking about is data in Kenya. So I thought I should explain this because our freedom is sometimes misinterpreted. People have gone to court to stop this. But as they go to court, can they also explain to Kenyans, do the 1.4 million Kenyans have a right to life? Do the patients who suffer diabetes, do they have a right to life? Do the children who are being born, do they have a right to life? So this should not just be a matter of legal interpretation. But it should be also a matter that we must understand touches lives. Kwa haya, I just want to assure you, Madam, that we will do our best. Nitazungumza na Balozi Kerich, balozi wetu kule Washington DC, tuone vile tunaweza sukuma zaidi ili arrival ya the late bishop iharakishwe, to try and make sure that it falls within the schedule that you have planned for him to rest. So we will do our best. Nilikuja hapa nadhani karibu mara mbili kusali katika kanisa hili, na tukazungumza siasa kidogo, na Askofu Likava akaniambia, umekuja najua unatafuta uongozi wa taifa hili, ni vizuri and we welcome everybody. Lakini tulipoenda kwa ofisi, kando akaniambia, you know, you may wish to consider working with President William Ruto. That was the simple message. Hakusema ni lazima, alisema you may wish to consider. Na hatimaye tukakutana, tukaungana, tukawa kitu kimoja, na kwa mapenzi ya Mungu Mheshimiwa William Ruto sasa ni rais wa Jamhuri ya Kenya. So in his own way, he was very honest. He was conveying a message that in his opinion polling, he could see something. And he was advising me that my opinion polls are telling me something else. So work with your brother. And so it came to pass.
Huyu prime cabinet ni mtu mzuri. Ingawaje tunalia, nataka nikumiminie sifa. Mheshimiwa Musalia Mudavadi, endelea kutushika kama jamii, na sisi pia tutakushika kama jamii, kwa sababu tunamsindikiza huyu, na pia tusisahau kutengeneza maisha ya kesho. Hata nimeshangaa Mandako umesema mambo ya ajabu, ati huyu bishop anatoka Kakamega, lakini amekuja kuhubiria watu wetu hapa. Kama wewe ungekutana Halwale angeambia wewe uende Western. Mimi nashukuru wewe uko na roho mzuri, unasema huyu ni askofu wetu. So sisi wote
When I heard about this news, I was so shocked, and I just asked myself, so what will happen in this city? What will happen to IBC? Because the moment you mentioned IBC, the first person that comes to mind was Bishop Likava. Na mwimbaji mmoja akasema, hata mambo yawe mazito, ulisema tukuite Bwana. Ulisema tukuite mambo yakiwa mazito, Baba yangu na kuomba saidi ya moyo wangu. Ulisema tutaita Mungu, and we know the work Bishop Likava started will not stop, but it will continue to grow. And because of the love and the blessings he gave to this county and the work of God that he has done, the blessings of God shall also be upon this family, led by Mama and the children, and they will continue to work for God and serve God in this county. Asanteni sana.
They mentored us to go to school, to study, to get good courses, good careers, and to behave well. Now, I am a governor as a result of the preachings of Bishop Likava, Bishop Kishana, and the rest. They were really fiery. Na last Sunday, nilisema kwamba I go to know Likava because alikuwa na njia nyingine ya kusolve problems. Ukimwona tu unajua shida yako imekwisha. Na vile mheshimiwa amesema, hata mimi nilikuja hapa kutafuta maombi. Unajua